What if there were some tips, tricks and strategies that you could implement right away that would mean that you fall pregnant faster? Hi, I'm Dr. Kady. I'm a board certified family clinician. Welcome to HeyDoc. On this channel, we address important health topic, but with greater emphasis on women's health and fertility medicine. The first trick is drink more water. Yes, hydration. It's as simple as that. When you keep well hydrated, it helps your cervical mucus production. Adequate hydration is absolutely essential for cervical mucus production. Cervical mucus is the fluid that your cervix or the neck of your womb, which is the entrance to your uterus, produces. It changes in texture and consistency throughout your menstrual cycle. Around the time of ovulation, cervical mucus becomes more slippery, stretchy, and wet. However, in addition to your cervical mucus having that texture around the time of ovulation, you also want it to be more abundant around the time of ovulation. And that is where being well hydrated helps. If you have an abundance of this type of cervical mucus, which is wet, slippery and stretchy, basically it looks a little bit like the egg white. So if you have lots of this type of cervical mucus because you're drinking a lot of water, it will provide the optimal environment for sperm cells' survival and motility, which then facilitates their journey through the cervix and into the uterus. Therefore, by drinking plenty of water, you're providing your body with enough hydration to be able to produce a lot of this type of cervical mucus around the time of ovulation. And so hydration indirectly increases your fertility by increases the chance of the sperm cell reaching the egg in order for fertilization to happen. So water is absolutely essential, more important than you ever thought. Proper hydration leads to good blood volume and good blood circulation. So there is an increased blood flow to the reproductive organs. Improved blood circulation ensures that the ovaries receive a good blood supply of oxygenated blood that contains plenty of nutrients. And this proper blood flow to the ovaries is absolutely crucial. Why? Because good blood flow is needed to the ovaries for the development of healthy eggs. Tip and trick number 2 is do not smoke. By the way, that also includes vaping, ladies. In addition to affecting your fertility, we also know that smoking negatively affects the fetus in the womb. And we know that smoking affects the quality and the quantity of the eggs that are produced. There are 2 specific ways in which smoking affects your fertility as a woman. The first is that it reduces your ovarian reserves. That is simply how many eggs you have left over. As you may already know, the quantity of eggs that a woman has remaining in her ovaries diminishes with age. However, if you are a smoker, you are running out of eggs faster than the average woman who doesn't smoke. And so if you have a reduced egg reserve, it will naturally be more difficult for you to fall pregnant. Smoking or vaping, remember, also affects the quality of the eggs. Vaping is just as bad. Smoking increases the risk of genetic errors happening in the genes that are found within the chromosomes that are in the eggs. The genetic abnormalities that may happen as a result of smoking may lead to an increased risk of miscarriage and infertility.